For patients with bone-on-bone knee arthritis that is no longer responsive to conservative measures, knee replacement is an excellent option. The goal is to return to a more active and less painful lifestyle. Many patients here in the desert have a goal of returning to any of the 3 Gs: golf, gardening, and grandkids. Oh, and now pickleball too. But even a perfect knee replacement does have some important limitations. Many of these are related to the incision itself. The incision does cut through a skin nerve just beneath the patella that often results in numbness on the lateral or outside portion of the knee. This is most commonly permanent. Because of the incision and scar, the resulting numbness, and the general nature of the knee replacement, it is often difficult or even impossible to kneel on the operative knee. While this may improve during the recovery, sometimes it is a permanent limitation. On the other hand, if you are able to tolerate kneeling, you can certainly do so. Finally, the bone and cartilage that we trim away during surgery is much softer than the metal and plastic we use for the replacement. Therefore, it is common and relatively expected to have an occasional click with certain activities such as walking, climbing stairs, rising from a chair, and others. While this may take some getting used to, this is normal and should not be alarming. I find that these limitations of numbness, difficulty kneeling, and some mechanical clicking are usually very well tolerated as long as the patient is expecting them. Despite these limitations, the large majority of the patients are highly satisfied with the result. So here's to enjoying those 3 Gs.